Hello everyone and welcome back to GDC Classes English. So we hope that your preparation for MRB Pharmacist examinations are going really well, and the topic that we are going to see in today's Master Stroke series is about the Radiopharmaceuticals. So let's see what are the important points that we are going to see in today's session. So we will see the questions which are related to the storage, then dispensing and the disposal of the radiopharmaceuticals. Okay, the important topic from the MRB pharmacist examination. Let's see the first question. The very first question is dash decreases the bulk of the waste. Okay, dash decreases the bulk of the waste. That means this is the one of the procedure for bumping of the waste. Option A is incineration. Option B is delay and decay. Option C is concentrate and contain. Option D is none of these. Okay. So basically delay and decay will not decrease the bulk waste. Basically incineration. Incineration is a process of disposal of the waste by bumping them. So it reduces or it decreases the bulk of the waste. So option A, that is incineration, is the right answer. Okay. So incineration, option A, is the right answer. It decreases the bulk of waste and the activity is concentrated in a smaller volume of ash. So it decreases the bulk, whatever bulk will be there, by bumping into the ash. The generator is responsible for paying the disposal cost. The second MCQ is radionuclide generator is a device. Basically, it is a device that produce a useful short-lived medical radionuclide, and that is known as what? Okay, so basically one generator is there that produces different kinds of or the short-lived medical radionuclides, and they are known as what? Option A is daughter radionuclide, option B is parent radionuclide, option C is both A and B, and option D is none of the above. So basically option A, that is daughter radionuclide, is the right answer. So radionuclide of daughter, that is generated from the parent radionuclide. So generally daughter radionuclide, it is a short-lived and it is a medical radionuclide, whereas parent radionuclide will be long-lived and it will be of a non-medical terms. Okay, it will be non-medical. So from where it is generated, that is known as parent radionuclide, and what is generated, which is short-lived, that is nothing but the radionuclide. Okay, so option A, daughter radionuclide, it is a right answer. So here it is given radionuclide generator. It is a device that produce useful short-lived medical radionuclide, and they are generally known as daughter radionuclide from the radioactive transformation of a non-medical long-lived radionuclide, which we call it as a parent or the radionuclide. So for the MRB pharmacist examination, GDC is conducting the free test on the GDC classes app every day at 6 p.m. So if you have not downloaded the GDC classes app, please make sure that you download it from the Play Store. You have to go into the batches section and enter the code, that is MRB25, and you can give your free test. So make sure that you follow these steps, that is click here to download from the Play Store, then click on the batches section and click on the plus icon where you can enter your batch code, which is small m, small r, small b, MRB25 with no space in between. Okay, so you can give the free test every day at 6 p.m. So make sure that you avail this opportunity as soon as possible. The next question is, which radiopharmaceutical can be a radioactive element? Okay, so basically there are various radioactive elements which can be used for the various purpose like diagnostic and the treatment. Option is xenon, option is iodine, sodium iodide, 99 mtc, all of these. So basically all have the purpose in case of the pharmaceuticals. So all of the option is the right answer. We will see in the upcoming question what are their applications. So all of these elements can be radiopharmaceuticals and they can be a radioactive element. Okay, so all of this is the right answer. Next is, according to level of activities, radioactive waste is. So basically it is categorized into two types. First is according to levels. So according to the levels, we have three forms: high, medium and low. there is one more category which is based upon the forms, which is nothing but solid, liquid and gases. Okay. So according what they have asked, according to the level. According to the level, it can be high level waste, it can be medium and it can be low level waste. Okay. So all of these option is given. So option D, all of this is the right answer. Option D, all of this is the right answer. So here you can see according to level, high, medium and low. According to the form, it can be solid waste, liquid waste or the gaseous waste. The next question is, which of the following do not have any charge and not get affected by electric or magnetic field? So basically there are alpha particles, beta and gamma radiation, but they already have difference in the properties in terms of their charge, in terms of their ionizing properties. So basically alpha, beta, they are having ionizing power, but they are asking which does not get affected by electric or the magnetic field, that is nothing but the gamma radiation. So option C is the right answer. That is nothing but the gamma radiation. Okay. Now here we will see some of the properties. So here there are types of radiation, which is alpha, beta and the gamma radiation. Here it is given nature of the radiation which is formed. So here helium nucleus, which is having 2 protons, 2 neutrons. The mass is 4. It is a double. Okay, it is a double. Mass is 4, charge is +2, and it is expelled at high speed from the nucleus. When it is expelled, it is expelled at high energy, high speed. Then beta is also having high kinetic energy, and gamma radiation, it is having a very high frequency. The mass is 0 and the charge is 0. So here you can see it is having lowest ionizing power. Okay, it is having lowest. It is having to some extent, but the ionizing power is less, and very high penetration power. Okay, so these are some of the properties regarding alpha, beta and gamma radiations. Next is radioactive waste can be stored in the laboratory if half-life is no greater than, okay, if any radioactive source is there, the half-life. T-half means what? How much time the sample or the substance is taking to decompose to 50% than what actually it was present. So till how many days you can store in the laboratory? If T half should not be greater than 36 days. Okay, if it is not having more than 36 days, then you can store in the laboratory. 38 days, 36, 40 days. So remember it is 36 days. Okay, so option B is the right answer. 36 days is the right answer. So it should not be more than 36 days. If it is so, then you can store in the laboratory. Next is composition of a radiopharmaceutical is radionuclide, which we have already seen. Radionuclide is a composition of radiopharmaceutical, parent radionuclide and the daughter that we have seen. A carrier molecule is also there. The name itself suggests it is like a transporter which is taken to the site or to the area of the action, right? So both radionuclide and the carrier will be the part or the composition of radiopharmaceutical. Option C already given both A and B, so option C is the right answer. Okay, none of this is not there. So option C is the right answer. Okay. So composition of radiopharmaceuticals, first is radioactive isotopes. Isotopes is nothing but which will have the same atomic number but different mass number. So radionuclide that are injected into the body, so it is a part of radiopharmaceuticals, whereas a carrier molecule which will deliver isotopes to the area to be treated. Okay, so there is carrier molecule as well as radionuclide. So option C, that is both A and B, was the right answer. Which is the type of ionizing radiation in the following? Alpha, beta, gamma, all of this. Just now we have seen, although gamma is having lower ionizing potential or the power, but it is still ionizing. Okay, so alpha anyways it is there, beta is also there, gamma is also there. So all of this is the option, that is option D. All of the mentioned option contains the ionizing radiation. So option D, all of this is the right answer. So types of ionizing alpha, beta and gamma. These are the ionizing radiations. But remember that gamma is having the lesser ionizing radiation. Okay. The next question is, which is the advantage of radiopharmaceuticals? Okay, why we use this radiopharmaceuticals? Used for diagnosis and treatment of patient. Yes, we are using certain kind of radio pharmaceuticals to see the diagnosis or to identify the disease. So we are using it for that purpose. Common cure for cancer. Yes, it is also used to treat the cancer. Can treat multiple disease site. Yes, option C is also right. So basically option D, all of the following is the right answer. Okay, these are the applications. More applications are there for the radiopharmaceutical. Option D is the right answer. Let's see once again what are the advantages. It is used for the diagnosis and treatment for the patient. It is a common cure for cancer. Can treat multiple disease site. Widely available modes of treatment using the radiopharmaceuticals. Directly treat tumor, especially useful for bone metastasis. So anything which is affecting the bone, especially the cancer, can be effectively treated using radiopharmaceuticals. Can provide fast onset of pain relief. Again, that is one of the advantages. Radiopharmaceuticals are stored in, as we have discussed that radiopharmaceuticals are there because they have certain kind of ionizing power and all. It should not be stored like a normal condition. It should be lead shielding. Okay, lead or lead shielding should be there, not in a refrigerator or the ambient temperature. The thing is that alpha. Now there are various uh, rays, alpha, beta and the gamma radiation. So basically we will see in the diagram, lead shielding is the right answer. The reason is that, for example, alpha rays, okay, alpha rays cannot cross the paper. Here you can see this is a paper, but beta and gamma can cross through the paper, right? Now if you see aluminium, alpha anyways it will not cross, it is not crossing the paper. Definitely aluminium it will not cross, but beta it will cross the paper but it will not cross the aluminium. And gamma it will pass both paper and the aluminium but not the lead. So basically lead shielding will give you the assurity that the radiations both alpha, beta and gamma cannot cross the lead shielding. Okay, so it will not cross this barrier. So that is the reason lead shielding is given if you are storing it in the laboratory. So option A was the right answer. Next is, what precautions are to be taken in handling and storage of radioactive materials? Okay, never be touched with hand but handled with forceps. Definitely, because they are radiations, you should not touch it with the bare hands. You have to use the forceps. Okay, forceps to handle that. Should be kept in remote area and fluorescence should be removed. Yes. Should be properly dispose of radioactive material. Yes. So these are the precautions to be taken while handling the radioactive material. So all of the above is the right answer. That is option D is the right answer. Okay. One should not touch radioactive emitter with hand but handle with forceps. Smoking, eating, drinking, these activities should be prohibited while handling the radioactive materials. Sufficient protective clothing should be there. Area where radioactive materials should be monitored and should be carried out with great care. The disposal should be carried out with a great care. Which of the following is not a type of gas field detector? Okay, proportional counter, GM counter, semiconductor or ionization chamber. So there are various types. Basically semiconductor detector, it is not a type of gas field. And when we talk about the gas field, it should be inert like neon, argon, helium. It should be a inert gas. So basically semiconductor is not coming in the gas field detector. Basically it is a scintillation detector. Okay, it is a scintillation detector. The gas field detectors are three: ionization chambers, GM counter and the proportional counter, whereas scintillation detectors are inorganic scintillators, organic semiconductor detectors, photographic emulsions, thermoluminescence dosimeters and tracted detectors. Okay, so these are the types of scintillation, whereas gas field only three we are having. Okay, so semiconductor is the right answer. answer. So if you are preparing for MRB pharmacist examination, the theory books, the MCQ books are already available on GDC classes. You can enroll and take your this notes so for the preparation of MRB pharmacist examination, and you will get 200 plus premium test along with 35 plus minute test, which will ensure that you are fully prepared for the MRB pharmacist examination. So make the most of it and avail this opportunity as early as possible. So we'll move towards our next question. Isotopes are having, we have just now discussed that isotopes. Iso means what? Something is same. And what is that same? Same is what? Atomic number. Isotopes are the one which have the same atomic number but different mass number. Okay. So let's see option. Identical atomic number, identical. Anyways, this is partially correct, but we'll see option other. Identical mass number, it is not there. Identical atomic number and mass number, both are not identical. Identical atomic number but different mass number. Yes. Identical atomic number but different mass number. So option D is the right answer. So option D, same atomic number but different atomic mass number. Okay. Which of the following is used in the diagnosis of pernicious anemia? As we have discussed that radiopharmaceuticals are used for various purposes like diagnosis, treatment, cure of cancer and everything. So here is cyanocobalamin, calcium, iodine, gold. So basically option A, that is cobalt 57 cyanocobalamin, is the right answer for the pernicious anemia. Okay. Let's see the others also. So this we have already discussed. That is no, this we have not. Calcium 44 and calcium 45. So it is used to study the bone structure because it contains calcium in the treatment of carcinoma of bone. Okay. Carcinoma of bone is nothing but the cancer of the bone. Iodine 131, it is for the thyroid disease. Treatment of thyroid disease. Iodine 125 used in cancer, brachytherapy. Then gold 198. Remember, gold 198 is for the treatment of cancer and the tumors. Whereas cyanocobalamin, that is nothing but vitamin B12. Remember, sometimes they will ask you the alternative names also. So it is vitamin B12, diagnosis of pernicious anemia. Okay. So that is the right answer. Radioactive calcium is used, we have seen just now, to study bone structure, treatment of carcinoma of bone, and in the diagnosis of pernicious anemia. We know that in the diagnosis of pernicious anemia, we are using cyanocobalamin, that is vitamin B12. So, whereas bone structure and carcinoma bone, we are using radioactive calcium. Okay, both A and B is the right answer. Gold 198 used in the treatment of, again we have seen this gold 198, it is used in the treatment of cancer, photosynthesis, thyroid functioning, anemia. Anemia we are using cyanocobalamin, that is nothing but the vitamin B12. So option D is not the right answer. Thyroid functioning we are not using gold, we are using for thyroid functioning we are using iodine. Photosynthesis, that is a procedure, so that is not used. But gold 198 is used in the treatment of cancer. So option A is the right answer. Apart from gold 198, we have cobalt 60, gold 198 and holmium 166. Treatment of cancer and tumors. Iodine already described that treatment of thyroid disease, and B12 is for the pernicious anemia. B12 is for the pernicious anemia. These are the applications of radiopharmaceuticals. The method of disposing radioactive is, okay, what are the methods for disposing radioactive, because these are the harmful radiations will be there. Hold or decay, incineration already described, dump to sanitary sewer. Yes, all of this is the right answer for disposing the radioactive. So all of this is the right answer. Okay, option D is the right answer. Apart from that, you have dilute and dispose, waste disposal, dispose of as if not radioactive, ship to disposal site, incineration, dump to sanitary sewer, concentration, and contain, hold or decay. Okay, so these are the methods for disposal of radioactives. Which of the following device is not used in the measurement and detection of radiation? Ionization chamber, again we have seen. GM counter we have seen. Then we have seen semiconductor detector. So these are nothing but the devices which are used, but they are asking which is not used. Gadget apparatus we are not using. Okay, so remember A, C, and D. These are the options which we have already seen in the measurement and detection of radiation. So gadget apparatus we are not using. So this we have already seen, gas field and the scintillation detector. Generally the gases which are inert, we are using that kind of gases. Which of the following is radio-opaque compound? Barium chloride, barium sulfate, barium oxide, or barium phosphate. Okay, so when we talk about the radio-opaque material, it should be having it should not be very effective. So generally we are using barium sulfate. It is a harmless salt. That is the reason mostly barium sulfate is being used because it is a harmless salt. Okay, option B is the right answer. So radiopaque, these are the chemical compounds which have the ability to block the X-rays and it will stop it from going into the tissue. So that is the reason whatever radiopaque material we are using, that has to be harmless. Okay, so barium sulfate, it is an insoluble salt. It is harmless and used in a medicine as a radiopaque contrast medium. Okay. The radioisotope commonly used in bone scan is technetium 99M, iodine, gallium, thallium. Okay, so we have seen that TC, that is technetium 99M, we are using in the bone scan. Iodine, gallium, and thallium is not been used. TC, that is technetium 99M, is used in the bone scan. The next is the management of radioactive waste involves when the radioactive material is being taken care, collection, disposal, both are equally important. Okay, first is the collection and the disposal of the material. So both A and B is the right answer. Okay, option C, both A and B is the right answer. It involves two stages, collection and the disposal, and it should be identified and segregated within the area of the work. Measurement of radioactivity by how the measurement of radioactivity, those depends on collection of ions, those depends on collection of photons, both A and B. So the radioactivity is measured by both, which depends upon collection of ions and which depends upon the collection of photons. So both A and B is the right answer. Okay, both A and B is the right answer. Measurement of radioactivity, it is dependent upon the collection of ions and the photons, and they generally include alpha, beta, gamma rays, which we have already seen for the measurements. Which type of particle is having high ionization power? Now they are not asking which have the ionizing, they are asking which have the high ionization power. Alpha, beta, gamma, we have already discussed. Gamma is having the least, whereas alpha is having the highest ionizing power. But remember, it is opposite to the penetration. Okay, alpha radiations, they are having low penetration power, whereas gamma radiation, it is having very high penetration power, whereas the ionizing is opposite, low penetration, high ionizing radiation, and high penetration, lowest ionizing power. Okay, so remember these important things. In Giger-Muller, that is a GM counter, the cylinder is filled with which gas? Okay, we have seen there are ionizing and scintillators. So the gases which are filled, they are very neutral, non-reactive, nitrogen, carbon dioxide, argon, none of this. So it is argon gas. Apart from that, it can be helium, neon, because these are the inert gases. Okay, remember inert gases to be filled in the ionization chamber. So option C, that is argon gas, is the right answer. At low pressure, to which high voltage, typically 400 to 600 volt, is applied, and the inert gases like helium, neon, argon can be filled. Radioactivity, it is measured by polarimeter, calorimeter, colorimeter. So these are nothing but polarizing radiations, calorimeter, colorimeter. GM counter, which we have seen, GM counter is to measure the radioactivity using the ionization chamber. So option D, that is GM counter, is the right answer. Okay, option D, GM counter, is the right answer. So it is an instrument used for detecting and measuring ionizing radiation. It is used widely in applications such as radiological protection, experimental physics, and the nuclear industry. It is the sensing element of the GM instrument and named after the scientists 𝙂𝙎𝙎 and 𝘿𝙄𝙎𝙎𝙎. Okay, so two scientists, their contribution is there for measuring the radioactivity. Unit of radioactivity is Poise, Curie, Ohm, all of this. So Poise is not there. Curie, Ohm, this Ohm is not there. That is for the conductivity. So Curie is the all of this. Anyways, it will not be there. So Curie is the right answer for the unit of radioactivity. Please remember, unit of radioactivity is nothing but the Curie. So radioactivity is nothing but the release of energy from the decay of the nuclei of certain kind of atoms and or the isotopes. And the unit is becquerels, that is international unit. Okay, and curies, that is CI US unit. Okay, so two units are there, becquerels and the curie. These are the units of radioactivity. Next is charge on alpha particles is how many times the charge on proton. If you remember the table we have seen in the table, the charge on alpha particles is how many times the charge on proton. 4 times, 2 times, 3 times, or equal. We have seen it is already 2 times. Okay, it is 2 times. So option B is the right answer. Option B, 2 times, is the right answer. Okay. So here we have already seen helium nucleus of proton 2 and 2 neutrons. The mass is 4, charges plus 2. Next is, which electromagnetic waves are mainly used in the treatment of cancer? Alpha, beta, X-rays, or the gamma. Okay, we have seen this also. The gamma rays basically we are using in the treatment of cancer. You can remember it as low ionizing radiation. So generally we are using gamma rays. So gamma rays are used to kill cancer, to sterilize medical equipments and the radioactive tracers. As the gamma rays are strong enough to kill cancer cells, high-powered gamma rays are used to kill cancer cells inside the body. X-rays are used for checking of broken bones. Alpha, it is used in smoke detectors. Beta are used in the quality control to test the thickness of any an item such as the paper. Okay, so these are the applications of different rays. Next is radioactivity is the characteristics of which of the following. We have seen it is about the nucleus. Okay, it is about the nucleus. Electron, proton, they are outer. Nucleus, which is present in the center of an atom. So nucleus, option A, is the right answer. Okay. Radioactive decay is the process. It is a process by which unstable atomic nucleus will lose energy by radiation. Whatever the energy is there, it will be lost in terms of the radioactive. And a material containing unstable nucleus is considered as the radioactive material. So it consists of an unstable assembly of protons and the neutrons. These are present in the nucleus. So that is the reason nucleus is the main in terms of radioactivity. Okay. Atoms are radioactive if their nuclei are unstable and spontaneously emit alpha, beta, or gamma particles. An alpha particle is same as helium nucleus, hydrogen, proton, or positron. It is same as a helium nucleus. Okay, alpha particle, it is same as helium nucleus. This we have seen, it is a helium nucleus of 2 protons, two neutrons. The mass is 4 and charge is +2. Okay. So this is the similarity between alpha particle and the helium nucleus. So that was all about the 30 important questions from Radiopharmaceuticals, and we will see the next topic in the upcoming Master Stroke series. So stay tuned, and if you have any doubts, any queries, please let us know in the comment section, and all the very best for your examination. Thank you so much for watching the video.